Pediatric osteopathy. One of the best ways to learn to treat babies is that actually sitting on a treatment. And that's what I want to give you in this video, because this is the whole treatment with nothing cut out, so that you can see when things get difficult and what you have to do to get over that. And this is quite a difficult case because it's a beautiful baby, but there's some challenges for treatment. Challenge one, the baby is 16 months old, and that's kind of getting into that age where they're moving around a lot and it gets harder to treat. Challenge number two, the baby has been sick for about 2 to 3 weeks on and off, so they're not in a great mood. Challenge three, they just woken up and come in for treatment. And challenge four was that yesterday this child fell flat onto the back and smacked their head really hard. So with this introduction over, let's cut to the original audio soundtrack, because I had an osteopath associate sitting in with me, so I was actually explaining to her what I was doing throughout this treatment. Now, because of that, you will actually hear silences, and they won't be as fast paced as some YouTube videos, but definitely worth your patience because there's so much here in this video.
Let's see if she'll go to sit on the bench now.
Yeah, she hasn't been eating much lately at all as well.
Yeah.
You normally eat so much.
No, I squirted this everywhere.
Oh.
So sit her there, facing you. Yeah.
Sis, I know it's not really milk, it's actually water.
So you can already hear baby's very unhappy with the situation, doesn't want to be here and doesn't want treatment. So that's our challenge. How are we going to get hands on? Well, the first thing we do here is we back off and we wait. And then we're going to try to come in with the hands on. And you'll see how that doesn't quite work the way we want, and we need to adjust.
Okay, so spin it back round, facing you. Put her next to you. No, leave her next to you. Okay.
Do you see the puppies?
So we overcooked
Not
it.
this one.
Try to get on the bench. She won't
Most
go for
puppies
it.
like to
So we have to
swim.
back off.
But not
So
this
that's
one.
either back where we were positioned before.
Most puppies like to
So she won't go for
play.
that. So it's
But not this one. Do you feel
close to
that?
mum. So all we're trying to do now is literally, again, I'm not trying to treat. I'm just trying to get my hands on
Chase. But not this
without
one.
cracking it.
Look. Oh,
If
what does
I
that feel
Jenny
like?
to touch and
What does that
treat,
feel like?
she picks up on that intent.
Ooh.
Bit of background noise there, so I will repeat that and clarify. What I'm doing there is getting my hands on with absolutely no intent whatsoever. I'm not treating, I'm not trying to treat. I'm just simply thinking, I'm going to place my hands on baby and hope that she doesn't cry. And because I don't have an intent in that, I'm not trying to treat, just placing them, just touch, that's it. Baby's then able to cope with that, and then we can move on into the next stage of treatment where she's starting to get used to my touch, and we can get into treatment. So I'm asking mum about the fall that the baby had yesterday, because now we are actually into treatment and doing something. Now it's only been 45 seconds that I've had to wait. Now it seems a really long time, but it's not. 45 seconds is hardly anything at all, but it enables us to get that contact where baby's happy with that, and then we can move into the treatment. Now I ask about that because as mum tells me about the fall, I can visualize what's happened with baby, and that helps my hands match baby's body and helps me get into the treatment more and get into what's going on. Now again, we lose the audio here because mum's telling baby a story and entertaining her, so I'll voice over for you. Basically what I was explaining is that the baby, when they fell, there was just, this shock, which is why I got my mouth open there. There's that baby was like, stunned, because baby didn't cry. And that was so important to elicit out of mum. So what happened after baby fell and hit their head? Nothing. Baby just didn't do anything. It was completely stunned and then cried afterwards. And that tells us there's shock in the system. And so it's that shock in the nervous system that we have to go to first and treat that. And I'm doing that via the pelvis. Now, of course, baby whacked head. So mum is expecting, possibly, for us to go straight to the head. This mum is an osteopath as well, so she knows that we don't need to do that. But you might need to explain that. You explain why you're treating the pelvis. If we went to the cranium here first, it will be far too much for baby. Now, as a general rule, I never treat the cranium first. I always go elsewhere. But particularly when baby is challenged. We've talked about the fact that baby's been sick. We talked about the fact that baby is 16 months old. We talked about the fact that also babies whack their head. There's going to be no slack in the system there. If we go to the head, you've already seen babies upset. That will be the end of treatment. There'll be no coming back from that. So it's important to stage, and it's important to go slowly and work your way up to the area that's sensitive. Now it's been exactly 2.5 minutes since I've got my hands on the baby, and the first 30 seconds of that was not even treating, it was just placing them there. So about 2 minutes of treatment. Now I judge that we can try to get hands on cranium. This is quite early in treatment. You can go a lot longer than that, but it's going well because mum is doing such a great job of making baby feel safe. They're entertaining them, telling them story. They've got their arm around them. We've got the contact with mum. Baby's chest is to mum's chest. Baby's feeling really safe. And so we can try to get it up onto the cranium. Now it's awkward because my hand is in the air and I don't have a balance point. And so what I do is I get my hand underneath my elbow and I create a fulcrum. And so my elbow is on the bench, and I'm just explaining that there to my associate as well. My elbow is on the bench and my hand is locked into my other elbow, and it allows my hand on the cranium to be very light. And because of that, my touch is light, but also my intent is light. And so baby is great with this. Look, baby's engaging with the book. And that's why at 16 months old, treating in the seated position works so well, because you can get mum to entertain baby. The amount of stimulus coming in with the book is far more the stimulus that I'm putting at the cranium. And what I do initially, same as at the pelvis, I don't have any intent. My first thing is just to have touch without baby being unhappy. And then after that, I can start to treat and I can start to explore other parts of the cranium. Now I want to emphasize something. Here I'm switching between examination and treatment. I haven't done a complete examination, no, but that's because it's not possible at this stage because baby doesn't have enough slack in the system to let me do that. And so there's a treatment initially at the pelvis and then doing some treatment shock release at the cranium to enable me to have enough slack in the system to now come around and examine more fully and get a little bit more into what happened yesterday rather than just, general shock in the system and having that whack. A little bit more specifics as to actually what's going on in terms of that fall, the position, the shape of the head, what's happened with the cranium in terms of the whack, and anything else that's been going on for baby in terms of the general development of that. Now before we cut back to the original audio, I want to specify something here, and that is I am not palpating for the cranial rhythm. At no stage in this treatment do I do that. So if you're keen on cranial or you don't like cranial, it really makes no difference in terms of what I'm doing here in the treatment. I'm treating, you might say, in a cranial style because I'm treating the cranium and I'm doing softer techniques, but I'm not palpating for any of the cranial rhythms.
So we've got the back of the cranium on the right hand side is pretty jammed, and that's probably from the fall, but underlying that front of the cranium and that anterior dural girdle, which is a similar view, is tight, and so that's holding that front of the skull, and it means that the brain and the skull grows out more at the back, which is why you've got pressure on those areas anyway.
This'll do it, make it stop.
So if I'm not feeling for the cranial rhythms, then what am I doing? Well, I'm matching the system. I'm trying to feel the shape in the system and let my hands just go to that shape. So it almost takes it a little bit of exaggeration. So if it's coming back on one side, forward on the other, I just visualize that. I don't try and force it into that, but I just visualize that, and that visualization in my brain to my hand, to baby's body, and baby's body goes, oh, I like that. And it goes a little bit in that direction. We're talking millimeters here, millimeters. And that gives the body a sense of ease, and then it shows you the next pathway, what it wants next, and you keep matching and matching and matching physically, and then inside your head as well, you can be thinking, okay, well, baby hit this side, so that would have done that, they would have forced that forward, baby would have been feeling shocked, they would have been feeling scared, maybe they felt winded, they couldn't breathe in, now I can't breathe, their oxygen levels drop, panic, 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 panic. And so you're trying to match as close as you can the experience for baby. The experience physically, the experience physiologically, and the experience emotionally. And if you do that, then you get good results. And the closer you can get to the match, the better the results are and the faster they occur.
Why would it be coming back on the right, fall on the left? Okay, was that the bump? Did it do this? Did it do that? And that again includes your hands a bit more because you're thinking about the actual forces on them.
And as we get in the match further, we can be more specific. We can talk about the anatomy, get our hands on parietal, occiput, anterior dural girdle, the ADG that I mentioned. Be quite specific with our anatomy because that hones us in more, gets us a better match, better response, and the treatment builds.
More and more into the injury, more and more into what's going on in the body. And then that responds more, you get more information, and you continue in that cycle.
And now we're 7 minutes into treatment. Things are going really well. We treated the pelvis, we come up, we've done the examination of the cranium, treated the cranium with some shock. Now we can start to get more specific. I can change my handhold, I can look at different parts of the cranium and treat those and address those areas.
So she's got a little bit of that nasal stuff, snuffy
Yeah.
kind of pattern.
What's Miranda Panda up to? Oh, this bear's name's Star. Star Bear. Star Bear.
Because she even has the same posture as Rory. You know how Rory, when he sits down, he lets his arm drop over the back like he's very relaxed? Do you mean? She even does that. She constantly drops her arm. It's got to be genetic, you know, in the DNA.
She holds her shoulders up when she eats like he does. I'm like, put your shoulders out.
Is that then, do you think that
Yes.
Dill says she finds it hard to treat?
Oh, it's just hard to treat your family,
Okay.
full stop.
I did a little bit of that shock release after the accident.
But
On the same
I
sort of-
expect the more your child is like your partner, yeah, the harder it is to treat. Yeah. Actually, maybe
Or
not. Maybe the more they're like
you,
yourself.
yeah.
Actually.
I think,
That's what I was
yeah.
thinking.
Yeah.
But I did a little bit actually after that accident, which I was quite proud.
And look, even more than that, it's usually also just you're so attached to the treatment. You want the treatment to go so well, and you always think that you're not doing a great job and that you're useless, and you know that kind of messes up the treatment.
Like I started to do it and all I felt was and I was like, no, just calm down.
Yeah.
Yeah, put your head in here. That's fine.
It's the same way you reserve your worst behaviour for your
Loved ones.
loved ones. You reserve your worst treatment for your loved ones as well.
You're too close.
Yeah.
And how they say medical, you know, doctors can't treat their own.
Yeah, and that back as well. Can you slide your hand down just a touch?
Down came the rain and washed for Insia.
So there, I know it's going to be difficult because then you're taking her arm away, which she's not going to like. So if she comes around and try and catch eye contact me, and I deliberately look away.
Yeah.
And Linda's onto it as well. She pulls her in close.
Okay, it's really worth you re-watching that bit, and I'll explain what happened. So we're in a transition stage. We're trying to get a little bit more treatment. Baby's a bit, I'm trying to change their position. They look towards me. They look towards the danger, and I pull my head away. So they don't have eye contact with me. If they can't see me, often they'll let it go, and that's actually what happened with her there. She kind of went, okay, and also mum really super helped. She realised, pull baby in really close, so baby got that security as well. So do look at that again, really, really crucial in terms of your treatment. It can make or break the treatment. You're trying to go to that next stage, get that deeper connection, that more change, and you're pushing baby, you're pushing how much you can get, and it's an area where you can break down and really fall down, and so you have to use these little tricks to keep baby on side and so you don't push them over the edge.
Oh, it's a huge amount of shock coming through right now, which is why I think so the grizzle there,
This is not like this.
yeah, is more to do with the reliving the shock coming through than upset with what I'm doing now.
Do the propeller, do the propeller. Hey.
And sometimes if you can't move your hand enough, you know, you can do shock release through here, but let's say you want to work that a bit more and change your hand position, you can't without setting them. You sort of like take hold of the hand. She doesn't want that, so then she'll move her hand away, which will move her body. Kind of a little tricky. And the other way to do that is to take them up and to, yeah.
Where's Teddy going? Where's Teddy going?
Because ideally I want two hands on here.
Where's
And so now we've got to decide, can I get, no, you leave me fine. Can I get two hands on without upsetting the apple cart? And if I can't, then I'm better off staying where I am. This is a little bit to do with the way she's sitting, but also this is where the ribs, because ideally I want to be,
Yeah, so those ribs.
yeah.
So it's all about adapting, and sometimes you have to be a bit of a contortionist and move your body in different ways, but it's so you can get your hands on in a way that keeps baby happy.
So I'll get that second hand on, and even though it's not all the way around, it's enabling me now to project because of the direction of the fingers around as if they were around. So now we're running. And again, this was not directly, I'd like it more like that, but that's not going to work.
Incy spider climbed up the water's spout.
And I want it.
Down came the rain.
Now here we have the challenge of baby, but also the immense fun of treating babies. Baby doesn't want to move their arm. Okay, well, how are we going to get in and access those ribs? We get mum to take hold of the arm. We use our imagination. We use everything we can to get baby in the position that we want so we can treat, but at the same time keeping baby happy.
I'm stuck in that thorax.
Looking up, looking down, down, head, shoulders, knees and toes.
Can you put her hand on her head?
Head, shoulders, knees and toes. Knees and toes.
Oh, that's good. Yeah.
Do the propeller,
Like
do
this.
the propeller, do the
Okay.
propeller around
Yeah.
and around. Do the propeller, do the
That's
propeller,
good. That's
do
nice.
the propeller. Yay! Around and around, looking up,
I mean, it's hard to do this if the mum's not an osteo.
down,
It's like, do what?
down, down.
Do the teapot.
Do the propeller, do the propeller.
So mum's an osteopath, so it's very easy for me to explain what I wanted to do. But even if mum wasn't an osteopath, you can just say, put your arm up like that and bring her arm up. And so you use that cooperation. It really helps with the treatment. Now at this point, we're 15 minutes into treatment. 20 minutes elapsed altogether, 15 minutes of hands-on. And babies rarely will let you have more than 20 minutes hands-on maximum. So we're going pretty good. So at this point, I'm going to push. I push a little bit here and it upsets baby. And so I back off. And this is the point where we just, okay, let's just chill a bit and see where we are. We've got plenty of time.
So this is when you just back off for a bit and let her write your notes. You know, give you a chance to write the notes because you need about half an hour or whatever. We're running out of time. Well, we can write the notes in 4 or 5 minutes or maybe settle in and then we can see where we are in terms of do we need to do any more? Whether she's literally just full up. She might be just, you know, that's it. Yeah, she needs more treatment, but she's full for the day. You were done, yeah.
You mixing your giraffes today, haven't you? Push, squish. Push, squish.
Yeah, and she's probably done for the day.
So we give baby that break and then we come back on very gently on the pelvis. Not happy with it at all. So we're going to back off again, give it a little bit of a longer break. As I said, you can write your notes at this stage, and in which case that's great, because not only are you saving time doing your notes that you have to do later, but also your intent is on your notes, so it's not on baby. So again, not just for your touch of backing off, also your intent as well. And then just see how baby is. This is also a great time to be talking to mum or dad and giving them some advice, and also just explaining what you've done, because sometimes you can talk while you're doing the treatment, but sometimes you can't because you want to focus more or because mum is concentrating 100%. I mean, you know, here mum was doing such an awesome job of making baby feel held, making them feel safe, reading them books, holding them. And so if they're doing that, they aren't able to concentrate on what you're saying, and so then you can take this time to explain what's happened with treatment. But overall, less is more, and the temptation will be for you to overtreat.
Oh, look, you got some olives.
We had olives.
That's
Oh, no, and a chicken and everything.
That's alright.
Shocking.
Sometimes babies had too much treatment, or in this case, maybe I just had done too much treating and I needed a break, and I managed to throw the baby's food all over the floor, which was a complete disaster. So I'm going to fast forward this bit because it was just me spending a minute picking up bits of chicken and all sorts of things off the floor.
Oh, so quiet. Oh, so quiet. Good job. Oh, so quiet. Nice kiss.
Angelina.
Ah, where's Angelina? Do you do the propeller? Do the propeller.
Actually,
Do the
just relax it a little bit and then see.
So sometimes distraction is what babies need, and then they don't notice what you're doing, but other times it's just they need to be close to mum and comfort, and so it's judging between the two. So here, no more distraction needed. What we needed, that quiet, close to mum and her feeling safe.
Oh.
Yeah.
Big hug for mum.
Danger.
Isn't it? Hey, that was a big hug for mum. Incy spider, climb up the water spout.
So when they chuck a fever, and obviously your hand, foot and mouth, you can get that fever as well, then that anterior dural girdle can get really, in fact the whole dura can get really heated up.
Incy spider, climb up the spout again. Yay! Twinkle, twinkle, little star, how I wonder what you.
So she's done because I'm that far off the body and she can sense, and yeah, you can say peripheral vision, but whether it's peripheral vision or she can feel me.
A few points to clarify here. The first one, while it's in shot, look at my two hands. I'm using the one hand to steady the other hand. And the reason for that is that it means that my hand that's on baby can be much lighter because again, I'm creating a fulcrum for myself with the other hand. Now the other point here is I've just said, well, baby's done. Well, if baby's done, what am I doing? Why haven't I stopped? And what I'm doing here is I'm no longer actively trying to create change. Instead, what I'm doing is integration. So we worked on the cranium, and now we're coming back down to the lower part of the body, the sacrum and the low back, and we're just getting a little bit of focus away from that cranium because it's had a lot of treatment, and before that it obviously had the injury as well. So we're allowing the whole system to integrate and settle as a nice way to finish treatment. And providing that baby is absolutely fine with your hands on at this stage, then that integration, you can take quite a while for that. 2-3 minutes, you can hang out, you can talk to mum while you're doing it. You can do two things at once. Too much intent when you're in there, then it's not integration, now it's treatment, and baby will respond to you and they won't like it because, like we say, they're already done, they're cooked for the day. And that cooking analogy is a good one. You want to bake a cake, it has a certain amount of time that's going to be in the oven, that's great, and then what happens, you don't eat it straight away, you bring it out and you let things settle. And so that's what we're doing there. We've cooked baby, and now there's a little bit of settling. But if we stick it back in the oven again, that's going to ruin the cake. Same here. If we start treating again, that's going to ruck baby up, and we're actually going to go backwards and undo some of the good that we've done. But just like we can overcook our treatment, we can certainly overcook that integration as well. We've had 2 minutes so far up to about this point, and you can see baby, look, they're just giving us those signs, and so this is about time to wrap it up. So we're going to wrap up that integration now. And that's almost bang on of 20 minutes hands-on in terms of treatment. Well, maybe it wasn't 20 minutes of hands-on treatment because you have to discount 2 for picking up food. And as you can see here, I've managed to wipe it all over the floor and all over my shoe. And so you can see video footage really works when you want to learn to treat babies. It shows you everything, when it goes right and when it goes wrong. And then we can use audio commentary on top to pick out different aspects so you really get to understand what works with babies and what doesn't. Of course, sitting in with someone and having personal tuition is the best way to learn. But look, that's not possible for most of us. Even with my associates, we rely very heavily on tuition like this via video because they're busy treating, I'm busy treating, so we rarely get a chance for someone to sit in and actually learn like this. And that's where the video footage works so well. We can shoot so much video footage that we can pick out the bits we want in order to build a course. And that's why all of the Kindred Academy courses are built around clinic footage like this, showing you exactly what works.